All right, welcome back to the Sporting Tribune today. My name is Grant Mona. I'm honored here at the Sporting Tribune to have Dr. Kevin Farmer from the University of Florida Department of Orthopedics and Sports Medicine. He is a team physician for the UF Athletics Association, a former high school All-American athlete, and a collegiate baseball player. As a former collegiate baseball player myself, we have that in common. He earned his medical degree from Johns Hopkins University School of Medicine in '03. Became orthopedic surgery at the Johns Hopkins Hospital. He has published 14 book chapters and 80 peer-reviewed publications in journals such as the Clinical Journal of Sports Medicine, the Journal of Bone and Joint Surgery, and the Clinical Orthopedics and Related Research, and is currently a board member for the American Academy of Orthopedic Surgeons and the Southern Orthopedic Association. So, Dr. Farmer, thanks for coming on. I appreciate your team, your communications team, reaching out to me because I am very passionate about this subject. So, thank you so much for coming on. How are you doing?
I'm good. Thank you for having me. I appreciate that introduction. That was very thorough. So thank you.
Of course, of course. So we had to give you your flowers. So obviously, Dr. Farmer, we have a little bit of a conversation, a topic of conversation within sports right now, specifically basketball. There seems to be I wouldn't say an epidemic, but there is a rise in Achilles tears. There is a rise in injuries across the board for the NBA. And a lot of people direct it back to the calf strain. We just saw Tyrese Haliburton go down with his Achilles tear, and he had the calf strain before that. We saw Kevin Durant do it in 2019. Is there a correlation between calf strains and Achilles tear? I think I already know the answer because we've kind of had that data available, but what is your opinion? What does your expertise say about the relation right now between calf strains and Achilles tears?
Yeah, the biggest risk factor for any injury is another injury, basically. So when you've got another injury, your gait may be off, your mechanics are off. In this case, you've got a muscle injury, so the calf muscle maybe is not as flexible as it normally is, and that just changes the stress and the strain on the rest of the lower extremity. And in this case, when you change the stress and the strain, one area that needs to get a lot of stress is the Achilles. And so I think the correlation is that by having a preceding injury, you're always at risk of having something else. And so part of the thing with team doctors that we have to deal is what are the pros and cons and the risk and benefits of putting an athlete that has an injury back out there. And I think both these cases you mentioned, I believe, happened in the finals. Certainly Tyrese did. I think Durant was as well.
Yeah.
And so these
Mhm.
are both injuries that probably they wouldn't have played if it was, in the regular season or the middle of the season. But when you're in the championship game seven of the finals, maybe you take a little bit of a bigger risk or maybe a little more aggressive and you play. And unfortunately, in both cases, they had other injuries.
Yeah, because, a lot of people are talking about the different types of shoes, the play style, the pace. In the 50 NBA seasons spanning from 1970 to 2019, there were a total of 47 Achilles tendon tears. And in 2024, 2025 alone, we had eight, beginning with the
Mhm.
DeJounte Murray one back in the early season and stuff like that. So, is there a correlation with the speed of the game, the athleticism, the explosiveness that some of these guys are showing right now? Is that a correlation with some of these Achilles tears? Now, again, eight doesn't seem like a lot, but compared to other seasons and other, eras, I guess you could say, it is a lot. So is there a correlation between how athletic these guys are, how explosive they are, the training methods? Does that relate to these Achilles tears?
Yeah, I think it's all related. I think pace of play. So when you add more reps, you have a higher risk of fatigue, and all those things are known to be risk factor injuries. I think the Pacers led the league in number of plays this season, and they had two Achilles. And so, when you start adding reps, you add the explosive. Achilles injuries tend to occur on a we call eccentric, where you're lengthening the tendon against a flexed muscle, a tight muscle, and so an explosive play, you're more likely to have this eccentric type stress on it, and so I think the pace of play and it definitely has a role there. You mentioned shoe wear. I think that there's certainly There's been an evolution from the high top shoes to the low top shoe. I think from what I remember, I think Kobe was one of the first to really kind of make
Yeah.
that transition, and he had Achilles obviously, but they started to realize that they had more agility, more explosivity with the lower, lighter shoes. But studies have shown that high tops decrease the stress on the ankle and the Achilles by about 8 to 10%. And so there's a trade off there, I think, I think all those things are likely playing a role for sure.
Yeah, because, a lot of my friends are talking about, oh, why doesn't he just wear high top shoes? When they have these ankle injuries, Steph Curry was one of the ones where he wore those big ankle braces, right? When he had those ankle surgeries early in his career. And, those braces kind of, saved his career. It allowed him to really be the player that he is now. So is is there a conversation to be had about low tops, mid tops, high tops? I know you just touched on it, but is that really a factor for Achilles tears, or is it more so training and the movement that happens with that?
Yeah, I think it's more the training and the movement. I do think if you're somebody that's dealing with, the biggest, if Damian Lillard, I remember around the Olympic time, he was dealing with some, this was 2020 Olympics. He was dealing with some Achilles tendonitis and then eventually tore it. So the biggest risk factor for tearing your Achilles is some previous Achilles issue. Most of them complain of some prodromal symptoms or having some tendonitis in the past or needing to get treatment. And so I think if you're in that category where you've had some Achilles wear and tear and have had to get treatment and you maybe missed a game or two because your Achilles is sore. I think if you're in that group, then you need to do whatever you can to minimize the stress on your Achilles and taping your ankles and high tops, maybe putting in a little bit of a mild heel cup or heel wedge to decrease the kind of the length of the Achilles. All those things I think are probably important to minimize the risk. And so I don't think it's everyone needs to go back to the old school high tops. But I think if you're somebody that maybe you're having to deal with some issues, there is some data to show that it does potentially add some protective factor to it.
And you talked about Damian Lillard. We just had him. We just had Victor Wembanyama. With these blood clots. The blood clots would have nothing to do with Damian Lillard tearing his Achilles, right? That is a completely separate issue because some people have said, well, he dealt with the blood clots in the leg and that could have contributed to it. Is there a correlation there, or is that just something separate that he was dealing with?
It's likely separate, but if you're having to miss time, so if you look at Achilles tears historically, it's bimodal. You get it when you come back from being off because you maybe haven't trained enough to get back to that point, and you get an injury, or you get it at the end of the season because you're fatigued. So with Damien, I can't remember how much time you missed, but if you missed, a couple of weeks or a month or two with a blood clot, maybe he wasn't as active. Maybe he gets some deconditioning, and the tendon isn't as strong as it was. Tendons, just like bones, they react to stress, and so if you're not doing as much or not using them as much, or muscle too, you gain muscle by doing more, and you lose muscle by doing less. Tendons respond the same way. So if he was took time off because of it, and he was a little bit deconditioned, there's no question that that can increase your risk of an injury.
So that begs the question too, if rest really does help, if you lengthen the season, you give these, you don't play back to backs, you give them a little bit more rest in between games because, a lot of people, doctor, are saying that 82 games is too much. You got to go to 60 games or 65, like we've seen in lockout years and stuff like that. Do you think that has would have an effect on the plague of injuries that we've seen? Because we talk about these injuries all the time, and I'm not even talking about just Achilles injuries, but the ACLs, the tendons, the ligaments, a lot of these injuries that we're seeing. Would rest and more rest in between games help that, or is that just kind of a fallacy that fans are making up in their head?
No, I mean, fatigue is one of the biggest risk factors for injury. And so if a player is getting fatigued, if they're later on in their career, then maybe they're more at risk of fatigue. Technology has advanced so much that we can really kind of hone down on the amount of work somebody is doing over the course of games and practices and seasons. We have GPS. We may have heard of catapult. Most people wear a catapult device, which kind of measures your movements, your steps, all these different things. Here at the University of Florida, we watch that very closely. If we have a player that we know, let's say, has had a history of hamstring injuries, we watch the amount of reps they're taking in practice. And we get to a point where, like, hey, he's kind of reached his max. We go to the coaches and say this player probably needs a break for the rest of practice. And so I think they do that at the high. I'm sure they do at the highest level. But there is certainly a correlation between fatigue and injury, and it's something that may need to be even more closely managed as time goes on.
You know, when we look at these injuries that have happened, a lot of people have said, well, is there anything that can be done to prevent this Achilles injury? We talked about resting the calf and getting, the fatigue factor and all that. But is there any specific movement that you can do to strengthen the Achilles to make sure that this doesn't happen to players, or that is there a method that someone can use to strengthen that area to make sure that this doesn't happen? Or is it just a product of, hey, it could happen to you, it could just happen at any moment?
Yeah, I mean, we have data with the ACL that there are certainly preventative exercises you can do to minimize ACL injury. I don't know of any studies on the Achilles per se, but one of the best things for tendon strengthening is negative, so eccentric exercises. So, again, I would, if I was working with a team that's had a handful of Achilles injuries, I'd have all my athletes doing negative calf raises all the time. So that's where you go up and then, either with body weight or added weight, but you go up on your toes and you go down for a count of 10. And so as you go down slowly, you add stress to the tendon. It allows the collagen fibrils to line up in the direction of force, and that strengthens tendon. Eccentric exercises, or more commonly called negatives, are very good for tendon issues. And so that's something that I would add to a preventative program and somebody you're trying to reduce the risk of an Achilles injury.
And speaking of preventative stuff, I played collegiate baseball. You did as well. We've seen an influx of Tommy John surgeries in pitchers. There's been so much conversation about this as well. What we can do to kind of lessen the injuries to the elbow, to the shoulder that we've seen in major league pitchers, not just major league pitchers, but it's starting now at the youth level. It's getting through high school to college now. It, with Tommy John and pitchers and that UCL reconstruction, is this again just a product of players just becoming more athletic, becoming more dynamic, the training involved? Is it similar to what we're seeing with the Achilles injuries and with the injuries in basketball as well?
Yeah, no, that's a great question. I'm glad you made that transition because that's been my thought here, and with the recent rash of Achilles injuries, that the Achilles to basketball is what the elbow is to baseball, and I think a lot of this boils down to even the change in how youth sports have changed. You remember when you and I grew up playing, we had, little leagues, some travel ball, and I had was AAU, or not AAU, but I forget what they call travel baseball. It wasn't what it is now. We weren't doing showcases every weekend. We
No.
weren't trying to take radars and press every throw 100%. Let's press the radar. We weren't looking at spin rates. And so everything now is about numbers and individualization. So in a basketball player, they'll probably, just like a baseball player, they start to specialize at young ages. So they're just doing that sport. Whereas when you and I grew up, a lot more kids were playing football, basketball, baseball, and it was seasonal. So that gave you a chance. If you're a basketball player, it gave you a chance to rest during baseball season because you weren't doing the jumping as to the amount that you did during the basketball season. And so I think why one of the reasons we're seeing the increase, like Achilles tendons tend to be an older athlete injury. And I say older, 30s, late 30s, early 40s. Kobe was the end of his career when he tore his.
Right.
We're seeing the younger athletes. I really think it's because that the youth stress on it from the way that we do youth sports now is setting these kids up for risk, just like the risk on the elbow is. Everyone's trying to throw harder. We know that the biggest risk factor for arm injuries is velocity. The harder you throw, the higher your chance of an arm injury. We know that volume is a big risk factor. So if you play year round, if you grow up in Florida or Southern California or Texas, you have a higher risk of it. And we've done this study. You have a higher risk of an elbow injury than somebody who grew up in Chicago or
Oh,
Big
wow.
Ten country, because we play year round in the warm environments and they can't. And so I think those two things. I'm glad you brought that up because those, in my mind, those two issues are very synonymous. That why we're seeing it is because of the evolution of the approach to sports in this country, and starting at the youth all the way up.
Yeah, it's a really good correlation. I agree with you because not just for that factor, but we are introducing new ways of repairing the Achilles too, right? And repairing the elbow as well, right? Because we have the speed bridge technology with the Achilles, right? I wouldn't say it's
Yeah,
new, but it's starting to become more common. And with the elbow, one of my buddies had the brace surgery. So are those two methods better? I mean, I wouldn't say better because there's so many ways you can go with this, but are those two methods a progression in medical advancement, or are those two just different methods of getting someone back on the field, back on the court, back to themselves?
yeah, it's definitely an advancement in technology, and actually those two things are very, very similar. So the speed bridge is also an internal brace, and so the biggest issue with Achilles repairs and what limited the return after surgery historically is the risk of it lengthening. You may remember Dan Marino a long time ago had an Achilles tear
Yeah.
in his plant foot. He lost push off strength, and I think he played his last couple of years wearing what was called an AFO brace to try to get him some strength back because his Achilles lengthen. And so that's the big issue. But now we have a way where we can actually connect the top part of the Achilles tear right to the heel bone through the speed bridge or internal brace, and that protects the and keeps it from lengthening. Same thing with the internal brace on the UCL. You can now, instead of doing a Tommy John where you reconstruct it, you can actually repair the UCL and then add this reinforcement, this internal brace, and get an athlete back much quicker. You can get athletes back now 6 months or 8 months as opposed to 1 to 2 years because you're not having to wait for a graft to incorporate and heal the bone. You're letting the athlete's own tissue heal. So I think the evolution, the technology, the studies, people have really improved the outcomes, and that's allowing these things to be more successful and allow people to get back quicker.
So, in your estimation, is it better for players to take that longer recovery period? I know with these new technologies, you said that they can come back a lot quicker, but is it recommended that they still take the 12 months that is kind of the stereotypical recovery time for an Achilles or a Tommy John? Because everyone says that, okay, well, Jayson Tatum's missing all of next year. Damian Lillard's missing all of next year. Tyrese Haliburton all of next year. When a guy gets Tommy John, it's like, hey, we're going to see you probably in 14 months, right? So are those timelines pretty accurate for that group of guys like Tyrese, Jayson Tatum, Damian Lillard? Because a lot of people said, "Oh, well, what if they come back for the playoffs? What if they come back in April? Can they come back quicker?" And do you think that those players can come back quicker, or do you think that it's better for them to take the Kevin Durant route, for example, and sit out for 16, 18 months and make sure you're great when you come back?
Yeah, I mean, it's very individualized. I think with the technology we have now, I think you can safely get an Achilles back to being close to full go in less than a year, even 6 months in some cases. But if you're somebody that's got a, I don't want to certainly use money as a reason, but if you got a guaranteed contract, and you know eh, do you need to rush back? Do you want to give it time and make sure that you don't get re-injured? I think all those things go into account now. I guarantee you, if you got a guy who doesn't have a guaranteed contract, who's trying to get a contract, he's going to push and try to get back in 6 months. But somebody's got a long-term deal that maybe doesn't need to push it as much, and then they're going to talk with their people, their agents, and maybe say, hey, it's better for me to not rush it and make sure this thing's 100% before I go back. And so there are a lot of factors that go into it, but I think the technology and the rehab allows us to get somebody back. Aaron Rodgers was trying to get back in like 4 months or something, and so everyone's different. I think we have ways to approach it differently, but it's very multifactorial as to what goes into that decision making process.
Well, Dr. Farmer, we really appreciate your time. I know we covered a multitude of different body parts, injuries, sports. I really appreciate you coming on. Hopefully, we can do this soon, and hopefully, we don't get to see this influx of injuries, but we really appreciate your time, and thanks for coming on.
I appreciate you having me. Thank you very much.
All right, thanks. All right, that was Dr. Kevin Farmer from the University of Florida Health Department. We really appreciate him coming on and taking the time to do that show with us. Make sure you stay tuned to all the stuff on both my page and the Sporting Tribune's pages. We're going to have much more content as the NBA season goes on, as the off season goes on. We're going to have you covered with the NFL, the NBA, MLB, NHL, all across the board. So make sure you stay tuned. This is Grant Mona from Money Mo Media and the Sporting Tribune signing off.